Morning, everyone. First of all, I'd like to thank Dr. Veena and Arvind Eye Care System for inviting me for this today's event. So topic for today for me is screen time versus green time, lifestyle as a pillar in myopia control. So first we'll take screen time, then we'll look at green time. So what does a normal typical day in our clinic look like? Uh, parents, both the parents working as in IT, both of them may have low myopia. Currently, they are using phone for the kids only while they are feeding. They want to know how much of the screen time is okay, not for themselves, but to tell the babysitter. And what are the chances for the kid to develop myopia? And will there be any eye strain for the kid if they use too much of screen? So screen usage can be in multiple forms. Can be TV, video games, social media, augmented reality or virtual reality, educational content with a lot of tuitions and online classes, and smartphones and tablets. So is screen time amongst kids a huge problem? Well, this survey suggested that 42% of children below the age of 12 spend up to 4 hours every day glued to the screens. And this study, again done in the Indian children, looked at screen time in 15 to 18-month-old children, and the results were startling. Almost 99% of children were exposed to screen-based media till 18 months of age. Smartphone and TV were being viewed by almost 96% of children. Screen time was more than 1 hour in nearly 90% of kids. So what's the impact of technology on children, both positive and negative? So we need to find a balance between the two and try to titrate the dosage of screen time in kids. So what are the effects of excess screen time in kids? We do see a lot of kids end up having dry eyes, even with 1 hour of gaming. That was what the study found. And because of the reduced blinking during usage of screen. What about today's topic, which is myopia, onset and progression? All factors associated with near work and an increase in myopia refraction by 0.28 to zero point 0.3 diopters was observed in every hour spent in digital device. So closer the working distance, prolong the screen time, and only 10 minutes or more of 2.5 diopters of accommodative task at downward gaze was sufficient to stimulate axial prolongation or elongation. Other effects of excessive screen time is the acute acquired comitant esotropia, which is again very common in kids nowadays, and the digital eye strain. Multiple studies have also found that, especially during COVID time, this was found to be increased in prevalence. So what are the effects of screen time on kids? Not only about the myopia, but other effects on the brain, social impairment, delay in language development, as well as sleep challenges. In the brain, it has been children who use more than 2 hours of screen time, they have been noted to have thinning of the frontal cortex, which helps in critical thinking and reasoning. Prevalence of imagined play also decreases in such kids. Social skills also suffer. Screen time limits the interpersonal contact, which inhibits kids from developing the social skills they will need in the real world. So we do see a lot of kids having needing therapy to get de-addicted from such addictions, especially screen usage. Language development also is one of the side effects of using too much of screen. Infants who spend 2 hours or more a day on screens were 6 times more likely to experience language impairment in future. And sleep, blue light inhibits the release of melatonin, which is required for a restful sleep. So these are some of the other side effects apart from myopia, which are noticed with increased screen time. So the warning signs for anyone to look at screen addiction are lack of attention, anger or aggression, too much of tantrums if the child shows. These are things which you want to look for in a child. So what are the IRP guidelines for screen usage in children? So if anyone wants to take a photo, they can take, so which can be, they can go and, so this is what the suggestion is. Babies below 18 months, no screen usage. Children between 18 to 24 months, high quality programming content and co-viewing with a parent is allowed. And children between 2 to 5, 1 hour per day. Above 6 years, limited viewing up to 2 hours is still allowed. So reduce the screen, let them find some alternate hobbies, make them go outdoors more and exercise. So these are 10 effective, which I found online, effective strategies, and 2 most important ones being using screen time as a reward only and establish screen-free times for children in the day-to-day practice. Now we come to the green time, the other factors which affect myopia progression, the influence of the environment and lifestyle on myopia. So there is a Sydney myopia study which looked at outdoor time and which suggested that 2 hours of outdoor time reduced the onset of myopia. Okay, so that's most important, even in kids who had a lot of near work. But once already myopia has started, then they found it was not as effective. Other study in Guangzhou, China, suggested that again 40 minutes of outdoor time found was effective in kids doing outdoor work. This study is from Taiwan, where they looked at improving the room lighting and table height, encouraging more distance viewing and ocular exercises, and they performed intervals of near work of 39 minutes followed by 10 minutes of break. But they saw that nothing changed as far as myopia progression is concerned. After the education policy specified, they increased the outdoor time of at least 80 minutes per day. The myopia incidence then decreased from 17% to 8%. So which suggested it was more effective before the onset of myopia than after. Another RCT conducted in Shanghai, which evaluated the protective effect of 0, 40, and 80 minutes of additional outdoor time among 6 to 9-year-old Chinese children. They observed over 2 years that outdoor exposure and myopia progression were inversely related. So this evidence was very strong. So we look at each and every risk factor and what we have as far as evidence in our studies. The next one is looking at light levels. So the intensity of light also decides how good it is in effectively controlling myopia progression. So elevated light levels in schools do have a protective effect on myopia, according to the study. So higher ambient light at the desk level and at the blackboard level. So there are a lot of Chinese schools started using glass walls instead of the regular concrete walls, and which increase the ambient light inside the classroom. So this again has a very strong evidence in controlling myopia progression. The other important point to look at is the spectral composition. So there are various there are studies which have looked at it, but again, what we need to look as far as spectral composition is concerned is again light intensity. We just ask the kids to go outdoors and play, but then just being outdoors is, there are so many possibilities. So these are the various scenarios. So just an open field is having the maximum light intensity. So just this is the second one scenario is this playing in the playground outside the buildings, or in this just somewhere in the park. Then you have the window view that has a lesser intensity, and then you have no windows where it's completely dark. So the intensity of the light also makes a big difference as far as the myopia progression is concerned. So what we don't know about light exposure in humans is what is the timing which is needed, how much duration and pattern we need to look at as far as light exposure is concerned, and the spatial frequency of a different environment. So there is a possible evidence, but still strong evidence is not so far available. So make the kids spend a lot of outdoor sunlight time, make them look through the balcony, terrace, let them go outdoors in the park and beach. And also, if possible, talk to the child's school, ask the parents not to cut off the PT period in schools, and check the lighting levels in the schools if that can be changed. Vitamin D per se, the evidence so far is pretty weak in controlling myopia progression. The other risk factor is near work, accommodation, peripheral defocus. Again, has been discussed over the last few slides. So here there is possible, again, evidence for controlling myopia progression as far as these risk factors are concerned. Looking at near work, this is one thing which we need to look at very carefully, because children who read continuously for more than 30 minutes or who perform near work at less than 30 centimeters, who read more than 2 books per week, or read more than 2 hours per day, and then with every book read per week, the chances or increase in the myopia progression is pretty high. So again, a strong association is between a child's higher IQ or more number of school years or after school tuition with myopia progression has been established. So this is one thing which you need to do. You may ask the parents that your child, does he use screen? Does he use mobile? They may say, no, he doesn't use much of mobiles at all. But when you inquire more in detail, he just reads books a lot. He keeps reading all day. Or he just likes to paint. He just likes to do coloring work. So that is something which you need to inquire in detail. Look at what he does in his free time, and that will help you in formulating a plan for his myopia control. Other possible risk factors like urbanization, socioeconomic status, pollution, secondhand smoking. So far, the evidence is weak in all these factors. As far as sleep is concerned, melatonin, dim light melatonin onset can be again a biomarker, like Shruti was telling, of the circadian phase or circadian environment. So this is something which we are probably will know in the future. So in summary, strong evidence exists as far as outdoor activities are concerned, light levels and near work is concerned, but possible risk factors are spectral composition, spatial frequency, screen time, and sleep. Thank you.